So, so one more aspect of if we talk about the health sector is the mental health, and we are very well aware that not only in especially if I talk about Pakistan, so that aspect of mental health and how those trauma and other things are not being considered as a problem or as a challenge to solve. Is there any in the books or anywhere it is mentioned or it is happening on ground or anything you can share your experience?
Yes, particularly during this Easter Sunday attack, I think it
Mm,
was a shock to the entire spectrum of the society, irrespective of the religion that you follow in Sri Lanka. So we had from the health ministry perspective and also perspective of the disaster management authorities, we had a very sort of a challenging time how we prioritize mental health of these victims, because say like entire village, we had the each of the house
mm,
houses sort of impacted by this particular bombing. We had funerals in each of the house. So how you sort of approach this kind of a situation where the entire community is affected,
mm, mm,
how you approach the mental health services. So in a very traditional way, Sri Lanka's mental health structure was more geared towards, I say, psychiatry, or treating diseases of the mind, right?
mm,
So it's more of a very medicalized approach. But when it comes to disasters, you may agree, we do have to have the medicalized approach, but there is also this community element of mental health that
mm,
has not been prioritized. So this was exposed during the Easter Sunday attacks in Sri Lanka. So following that, most of the DRM and also the public health sector professionals thought how we can sort of manage this situation, and that is where the MHPSS aspects come in, and also the mental health first aid or psychological first aid, where you don't need a trained individual or a trained professional like a psychiatrist or a psychologist to entertain these aspects. So you can train a community leader, or you can train a youth person to deliver this psychological first aid. So those are the areas where we need improvement in Sri Lanka. I know not only in Sri Lanka, also in a very South Asian
mm.
perspective, the entire mental health spectrum is medicalized. So we need to sort of look beyond the medicalized aspects and go into community aspects of mental health, like the psychological first aid. So that is where our answer lies.
Mm. I think wonderful answer. Not only obviously the capacity of our health sector is not that good, and if we add the mental health aspect as well, so it will no doubt overburden. And I think using the community involvement in that aspect, it will be very wonderful idea as well.